Greetings, friends, and welcome to Parenting Pathshala, a school for parenting. This is part of the National Initiative and Integrated Resource for Child Protection, Mental Health, and Psychosocial Care, supported by the Ministry of Women and Child Development, Government of India, and located in the National Institute of Mental Health and Neurosciences, NIMHANS, Bangalore. Through this initiative, we wish to reach children, service providers, and stakeholders in the health, education, and welfare sectors to work in the combined area of child protection and mental health. This means education boards, schools, teachers, childcare institutions and their staff, child welfare committees, juvenile justice board, the judiciary, legal services authority, Childline India Foundation, district mental health programs, tertiary care centers, centers of excellence in mental health, any child, every child in the spaces that she occupies and inhabits. In August, we did a series called August Talks, focusing on child rights, education, mental health, and a new definition of loss, trauma, and grief in the context of COVID. In this new series called Parenting Pathshala, we hope to cover various facets of parenting. We had an initial talk with Mary Barua and Indumati Rao on parenting children with special needs. We had Joe Chopra sharing with us what happens when we are no longer there as children with special need grow into adults. We had Shanta Sinha focusing on the contentious issue of discipline and disciplining and the difference between disciplining and positive engagement of parents with children. And yesterday we had a program with Nirupama Rao focusing on an anthroposophic approach to parenting. Friends, it's my pleasure to introduce you to Dr. Alexander von Gontard. Welcome, Dr. Alexander. Alexander is a child and adolescent psychiatrist, a pediatrician, a psychotherapist. He was erstwhile the chair and the head of the Department of Child and Adolescent Psychiatry at the Saarland University Hospital in Germany. Dr. Alexander has trained in genetics and pediatrics, in child and adolescent psychiatry, and in psychotherapy. He has researched and published immensely on some critical issues in children, such as enuresis and incontinence and associated problems with children. Particularly important is Dr. Alexander's book, Buddhist Understanding of Childhood Spirituality, which is an evocative book on children's spirituality. It would be a matter of interest for all of you to know of the soul connection that Dr. Alexander has with us. He was born in Bangalore, in India, and spent most of his early childhood in India, in Bangalore, before his family moved to Germany. Dr. Alexander, welcome to Parenting Pathshala. The theme of today's session is preserving a sense of curiosity and wonder, nurturing young children. Let's have some opening thoughts from you, Dr. Alexander, on parenting and young children, and then we will go into some substantive issues that we would like to discuss with you and take some questions from chat as well. Over to you, Dr. Alexander.
Well, good evening, and dear Shekhar, thank you very much for your kind introduction, and thank you all for the invitation to be part of this series. And of course, it is wonderful to know that parents and colleagues in India will be watching at this moment. It's a very special occasion for me. The theme of the talk is nurturing young children, preserving a sense of wonder, curiosity, and awe. And awe and wonder is one of the main modes of spirituality in children. How does one define wonder and awe? Basically, it is seeing things with a freshness with an openness, almost as if you were seeing and experiencing something for the first time or the last time, this sort of quality. And this is typical of young children who are open to all stimuli of the environment and experience their surroundings in this sort of intensity.
Mm-hmm.
It is a bit like choiceless awareness, not giving priority to one over the other, but taking everything as it is. And the quality can vary from small little impressions like watching an insect or a flower in spring to very, very intense experiences that can really affect one emotionally.
Right.
Of course, the quality can change too, from very positive to sometimes also difficult experiences.
Correct.
Usually it is associated with a change of perception, sometimes of time and space, and one knows how children can be absorbed in their play when
Mm-hmm.
they are in wonder and awe. And often it's a feeling of I'm in my emotional home. I've returned home, and sometimes associated with a connection to others, not being separated. And this sort of spirituality is natural, it's spontaneous, it is inherent in every living person on this earth, and it can be nurtured by parents, but it is there already, it is not made, it doesn't have to be educated. And the most important thing is that this spirituality is, on the one hand, acknowledged by most of the world's religions, but it can exist outside of a religious framework. If you
Right.
look at the big religions, in Hindu, young children in the symbol of baby Krishna play such a wonderful role with his pranks and his lila. Baby Buddha in Buddhism, in some legends, is said to have been able to walk. These are legends, these are myths, and lotus blossoms sprung out of the ground wherever he stepped. And of course, in Christianity, the nativity scene and the birth of the child plays an important role. And young children are a symbol of hope, of new beginnings, of change, and of variance.
Wow.
And many um, quotations could illustrate this. One quotation from the Bible, for example, says, "Whoever welcomes this child in my name welcomes me." And a welcoming of the child, I think, is one of the most dear experiences that I had as a pediatrician. Because when I was working in a pediatric hospital for 2 years or so on, I went to assist the gynecologists and the obstetricians when there were difficult births, mostly cesarean sections.
Mm-hmm.
And as a pediatrician, I would stand next door to them. I would see the operating theater. I would see how the cesarean section was performed, how the midwife would take the baby, would carry it over to the next room, and I would just look at the baby. Sometimes the baby was ill, and I had to look after it medically, but
Mm-hmm.
sometimes it was just observing, seeing if it needed oxygen or the mucus should be suctioned off. And I looked at these newborn children and
Mm-hmm.
had often the feeling, I'm welcoming this little life to the world. I
Right.
was one of the first to see it. And if you look at young children, this is the topic of the talk, there are different developmental stages. There's on the
Right.
one hand the newborn, as I've experienced. There are the infants. These are children from age 1 to 18 months. And the word infancy comes from the word time before children were able to talk. Then the toddlers, the word comes from the uneven gait of young children, aged 18 to 36, and the preschoolers, aged 4 to 5, who make such a huge developmental step in their cognitive development. And the important thing of this age is development, development, development. There's no time in life where development happens so quickly, and the importance of relationships.
Right.
So baby and young children are dependent on caregiving relationships. They need nurturance, guidance, and care, but the other side is often overlooked. The other aspect of a relationship in how far young children can be teachers to us adults. What can we learn from this young and new life that has been presented? And I think we can learn exactly those aspects that this talk is about: openness, freshness, wonder, and awe. And there's some aspects that I think might be important for parents. So if you would allow me, I would like to uh,
Please,
give,
Alexander, go ahead.
give my thoughts to it, because I think these aspects might be helpful for parents to remember. One is recollection. Being in contact with a young child opens the opportunity to reconnect with one's own childhood. Let memories come up, just let them appear, and try to remember, how were you when you were this young? If you have had memories, be open to them. Were you vulnerable? Were you open? What were your aspects of curiosity and awe that you experienced? Another important aspect for parents, I think, is mindfulness.
Hmm.
Parenting young children is, on the one hand, one of the most stressful chores. On the other hand, it is one of the most fulfilling tasks at the same time. And sometimes in the busy everyday life of parents, the beauty of what is happening can pass by very, very quickly.
Right.
And there are many different ways to look at mindfulness. One definition is awareness of the present moment, of what is happening now, with acceptance. Accept what is happening at the moment. And sometimes when the day is very, very busy for parents, it can be a huge help just to stop, be aware of one's own posture, be aware of how one is sitting or standing on the ground, listening to one's breath, just relaxing a tiny bit, just get a bit of space into the situation, and then be open to what is happening. The other aspect, I think, regarding mindfulness for parents is that try not to judge what you're doing at the moment and not to put your activities into a negative or positive box. So in the daily routine of parenting, washing dishes or changing the diaper of your child can be just as fulfilling as listening to music together or singing with a child. So every aspect of the day can be an object of mindfulness. Another aspect is realizing the constant change of events, of impermanence. Your child is very young at the moment, and this time will pass extremely quickly. Can you be aware of how things are passing, how time is moving on, and always asking yourself, are you living and experiencing this time with maximal awareness? Then I think it's important for parents to take one step at a time, to concentrate on one activity at a time. In our country, there's always the saying that mothers are experts at multitasking. They can do everything at the same time. But actually, it is not so positive either for mothers or children if they endeavor to do this all the time. For example, recently I read a paper on mindless feeding. This is apparently something that young mothers are doing while they're breastfeeding their children. What are they doing? Looking at their tablets and their smartphones, texting friends, and this beautiful situation of breastfeeding is constantly disturbed by outer stimuli
Mm-hmm.
and by outer influences. Then, for parents with young children, again, extremely important the social networks. In India, you have such a wonderful tradition of involving families in the rearing of young children. Many women and many mothers in our countries can be very isolated, especially if children are young. So friends, families, activities, extremely important. And then another aspect I find important is don't put yourself under pressure. Um, what is needed is not perfection. Striving for perfection in child rearing is not the way to go. It is absolutely important if parenting is good enough, if there's a fit between child and parents, no more than that, that is wonderful. A few more ideas, Shekhar. I need a few minutes more and then I'm finished. For mindfulness, again, don't overtask yourself. Sometimes, if it's too stressful, take a time out. Sometimes it's helpful just to stop, count to 5. If you're irritated, then continue. If you're very irritated, then put your baby or young child into a cot or his or her bed, settle down, and just calm down and then address your child again. Again, if it's possible with family and friends, arrange to have some time off to yourself, an afternoon or evening per week if it's possible. And then a huge resource for families and young children is nature, nature, nature. Even in busy cities, there are public parks, there are trees. Even the grass by the road can be um, a resource. And for children, even wonderful small things are sufficient, like looking at a pebble, an insect, a twig, a blade of grass. And nature is not just limited to the outdoors. Indoors, some people have plants with young children, pets, and all this is a resource. And if possible, from time to time, the big nature with countryside, seaside, mountains, seeing the stars at night, these are all aspects that can reconnect you. I would like to maybe say a few words that I read in a wonderful book specifically addressing parents by Rebecca Nye on children's spirituality. And I think she has a few good ideas that might be helpful for parents to nurture spirituality in children. And what she says is give your child physical, emotional, and auditory space for spirituality. Physical space is select something beautiful for children to grow up with, if possible. Make your home as nice as possible. Emotional space means focusing more on feeling than on content. It's not the content, it's what the emotional tone is like. And auditory space, uh, put in simple words, is talk less, listen more.
Mm-hmm.
Take time to listen to your child. Then important to focus, shift the focus from production to process. So not looking at the end result, what has my child done, what has he or she painted or achieved, but focus on the process from one moment to the next, from one experience to the next, and not looking at the end results. Then foster imagination, foster any opportunity the child shows to go deeper in arts, music, and play. Offer these resources that are creative resources. Offer authentic relationships. Be a model to your child in your relationships, how you cultivate them and how you do this. And provide safety, feel safe to be as you are. This is what the child should feel. Have an adequate amount of closeness and intimacy. Be close to your child if adequate, but give enough distance and room if needed. And foster trust. I think this is important. Trust that life will unfold, that life will show itself, that it will take its way, and then the child will be able to grow up with openness and with trust in the process of life. I think I will stop at the moment here. I have a few more thoughts, but I think maybe we should.
Oh, this is a lovely beginning, Alexander, because it has already invited some comments from the audience, which I will put to you. But very briefly, the whole issue of parenting young children as being a context of hope, a new beginning, and also recognition of variance, and how recollection and reconnecting and all the sets of mindfulness parenting with young children, awareness of the present, accepting, not judging oneself, believing that we have only these 6 years when they are young children, and then the moment will be gone, and therefore being aware of the present and grabbing those to plan activities, keeping your networks intact without any self pressure on perfection, and not overtasking oneself, but create processes and spaces which really foster children is the essence of parenting young children. Now, here's a very interesting question, Alexander, that has come up, which I'd like you to respond to. And the question is from Dr. Lekansh, which is that are there dimensions of curiosity and awe and how to nurture them that are not necessarily mystical, nebulous, or spiritual in nature? Things that can be communicated, let's say, by reason or by plain speech and communication.
Yes, of course. As I said, the dimensions are regarding quantity and quality. So the quality, of course, in everyday life can be touching, from very beautiful to sometimes also touching, but a bit difficult. It doesn't necessarily have to be just sweet and enlivening. And the other is the intensity. And the nice thing about young children is that even small, wonderful, small, sometimes neglected objects in their environment can be fascinating and can be a focus of their attention that we adults do not see. For example, just collecting pebbles from the ground, or finding a twig, or looking at the rays of the sun when the sun sets or when it rises in the morning. This does not necessarily have them necessarily needs to have a mystical quality to it, but it can nonetheless be emotionally enlivening and touching.
There's a related issue that Biswajit Chakraborty has raised on the issue of curiosity and this, ba- uh, I guess, a balance between the mystical on one hand, but the very tangible on the one hand, because the rays of the sun and the warmth and the shadow that it makes, and the kind of play that you can do to look at people's imagination and work on hand functions, which are quite tangible. Vishwadeep's question is this: how do we keep the sapling of curiosity and wonder intact in the mind of children in this era of information overload, especially with the virtual media? And that's a reality that we have to contend with. Any thoughts on that, Alexander?
Well, I grew up in the analog world, so I'm a digital immigrant.
Right.
So when I was a child, there was no internet, no digital distractions. And I think a lot of what I was talking about at the moment is analog experience.
Mm-hmm.
And if you look at the recommendations of pediatricians worldwide, to put in very, very simple words, they all say reduce the input of electronic media in young children
Hmm.
as much as possible. You
Right.
cannot avoid it completely, and it would not make sense in our world to say go without it. But uh, just to put it in simple words, if possible, no electronic media before the age of 3, half an hour a day, ages 3 to 5, an hour a day in elementary school age, and 1 to 2 hours in the afternoon, in 1 to 2 hours in secondary schools. So this would be, for example, what I would advise and counsel parents to do.
Yeah.
Many parents unfortunately use the tablets as babysitters. The child is then quiet, looking at videos and games, but it will keep the children from experiencing important sensory experiences if they're focused on electronic media, just like the mindless breastfeeding of the mothers. They will lose out. They will not gain, they will lose out
Right.
if they do it at the same time. Does that answer the question?
Yes, indeed. And there is a related question which we will take to round off this part of the discussion and move into the next stage as we approach the halfway mark in this session. And the question is, how can parents engage with the sense of wonder and curiosity of a child when the questions and interests expressed by the child challenges the values, beliefs, and knowledge construct of the parents? I guess we are talking about these 5 or 6 years old who,
Okay.
yeah, or the terrible twos and the horrible threes, and
Mhm.
as they're often referred to, which I think is a very unfair label to actually use for these
Mhm.
wonderful human beings, who are so bright and so full of energy and curiosity. But how is this tension reconciled? How do they maintain it when the challenges start? And we know that um, 4 and 5-year-old kids, particularly in the digital natives as they are, and the kind of demands that even a 5-year-old or a 6-year-old can place on parenting, and how do parents negotiate this challenge?
Well, I think the important thing is what is the intensity and what is the quality of the challenge? Because there are young children who have marked degrees of oppositional and defiant behavior. And this type of behavior can be um, incapacitating for the families, for the children, and for others. So I'm not talking about this sort of challenge and the sort of extreme oppositional behavior, but children are curious, and especially the preschoolers are wonderful philosophizers. So they do have ideas, and these ideas need to be taken seriously because they sometimes address the big questions of life. So, why am I here? What is the meaning of life? What are the priorities? Why was I born? Why do we die? What happens when my grandfather dies? These questions need to be addressed, and what young children need is a dialogue partner. So enter into a dialogue, take the questions the children ask seriously, and do not put them off with quick answers. Try to explore, and sometimes it's better not to answer directly, but to question, to ask, what do you mean by this? What are your ideas? To listen, to question. And if the child is challenging, something that's always wonderful in these discourses can be humor. So do not take it as an attack towards your values, but take it as a sense of curiosity. And sometimes it can be very humorous as well. So take the young children seriously. Do not be worried if they question everything. It's their right to question. And as the child gets older and older, of course, every child has the right to hold different views than what their parents think, especially in adolescence, but that's a different age group.
Yeah, I love the use of the term dialogue partner. The
Mhm.
parent as a dialogue partner and not
Mhm.
merely a father or a mother. That let's shift gears, Alexander, and come to an aspect of parenting of young children uh, that is concerning for parents, and this is the issue of emotional and behavior problems in young children. How do you identify early signs and symptoms? We are aware of the particular interest that you have in the diagnostic classification of mental health and developmental disorders of infancy and early childhood, also known as DC 0 to 3, which is a kind of academic, technical, and scientific system that the world of child psychiatry uses to make diagnosis. Could you take us through your sense of DC 0 to 3 in a way that our audience, who are not all professionals, but these are people who are interested in children, many of them are parents, many of them work for organizations, some of them are teachers, so that we understand how these kind of systems are used to really clearly understand the emotional and behavioral issues in young children.
Well, thank you very much for asking this question, Shekhar. And we've had a few discussions about it as well. Um, Basically, I'm always astonished, really astonished, how well most children develop. So it is a wonder also that in most families and for most children, the process of development, of course, has their ups and downs and their difficulties and um, bright moments, but basically is quite normal. Now, unfortunately, there are some children who undergo crises, emotional diseases, or physical diseases, or disabilities, even. And it's very important to see that these events can occur, that they do not um, they're not unwanted. They're not wanted. It's not that one seeks them to appear, but for parents, it's important not to look at own faults, but to look at the problems clearly. And some problems are, how should one say, most problems in young children are multifactorial. So
Hmm.
you do not have a single cause that causes them, but different factors work together. So on the one hand, you have risk factors, and typical risk factors are on the one hand genetics,
Hmm.
prenatal and perinatal, so during birth and before birth, risk factors. Um, of course, emotional and should one say tense family relationships, a lack of um, care of young children when they are young. These are all risk factors.
Right.
Difficult temperament can be a risk factor. And of course, poverty and a lack of resources for some families as well. And these risk factors are counteracted by protective factors. So protective factors are, for example, a warm and nurturing relationship, especially during the first 2 years of life. Another protective factor from um, studies is female sex. So
Hmm.
boys are more vulnerable than girls.
Right.
Being the firstborn is a protective factor. Personality aspects such as humor, easy temperament, so you can regulate your emotions very well is a protective factor. Having friends, if the family has a good social network, these are all protective factors. And
Right.
depending on the risk factors and the protective factors, even young children can be affected by emotional and behavioral problems. So
Right.
it's not necessarily one cause, and it's not necessarily fault of the parents. Now, the DC 0 to 5 is really a fantastic classification system. Brought it along with me. Here it is.
Right.
It is not just for research, but it is really very helpful because it shows that even in young children, many different types of problems or disorders can exist. It's a huge range, and the rate is exactly the same as in school children and in adolescents.
Mm-hmm.
And looking at the 0 to 5, if you look at the table of contents, the first groups are problems that are mainly genetically determined, that begin early in life and have a high tendency to persist. They can be treated, but they are more or less biologically determined, such as autism spectrum disorder, children who have difficulty relating to others in a reciprocal way and who have repetitive behaviors and obsessive behaviors. Then ADHD was very common, attention deficit hyperactivity disorder. But in addition to that, young children can be affected by anxiety disorders, depression from the age of 2 or 3 onwards. Of course, young children, with the ones we're talking about, very young ones, sleep disorders, eating disorders, crying disorders, and not to be overlooked are the trauma-associated
Right.
disorders.
Right.
So, even classical post-traumatic stress disorder can affect children as young as 1.5 years. So even in this age, children can carry the effects of trauma in a way that their development is incapacitated. And DC 0 to 5 places a huge emphasis on relationship. So relationship is at the focus, not just the child's disorders, but the quality and especially identifying those relationships that are putting children in danger. So I think the DC 0 to 5 is a huge step forward and will help professionals to look at these problems in a different way, but also to signal to parents that if there are problems with one's child, do not hesitate to seek professional help. You can treat them. This is wonderful. And the earlier you treat some of these disorders, the less chance there is that they will persist into childhood and adolescence. So wonderful new areas.
So, some thoughts, Alexander, on how parents can manage these common emotional and behavioral issues in young children. What is the kind of advice, suggestion, and interventions that you provide to parents to empower them and to skill them in managing some of these common emotional and behavior problems?
The first step is to have a good diagnosis. So a diagnosis is means that you do an assessment, and from the assessment you come to an evaluation of the type of problems that are available, that are present. And this is important because each of these problems and disorders have specific types of treatment that can be helpful. So identifying the specific problems, so it does matter if a child has ADHD or depression. These are two completely different aspects, and each has a different type of therapy. But nonetheless, in my counseling of parents, the first thing is to welcome parents, to accept them unconditionally, how they are, provide warmth, empathy, to start from the current situation, to avoid finding fault, looking for guilt. This is what European parents like doing. What have I done wrong? Is there something I should have done? Is there something I didn't do? And taking it step by step, giving them information about the problems of their child, giving them hope and also showing very clearly that things will change and things will change to the better. Um, Basic advice is, of course, and this can always be helpful, to provide children with routines. So having a daily routine in the families is a huge resource. Having meal times together is a wonderful resource. Having meal times without distracting electronic media, very important. Switch off everything else you have. And to take time, and this is again something many parents do not take time to do, for play together. Um, just find at least 5 minutes a day for child-directed play, letting the child decide what is the priority and follow the child. These are general pieces of advice, and then
Right.
in this order you go into detail.
There are a couple of issues that have come up, and I'll summarize for you the
Mhm.
comments that have come from Anindya Sen, from Barigala Pranay, and from Shutapa Shohumitra. If you look at the kind of advice that you would give to parents, what, as you have described now, for emotional and behavior problems, but if you look at it in the context of what is happening now, increasingly children are having to spend more time with the adults and authority figures rather than with the peer group. And so, what is happening in the kind of how they see these adults behaving, that so that's one part of the question. The other is, what if children are treated in bad ways by their own parents, and they're punished, uh, and how would dealing with these kind of children, and what do you suggest to parents when you know that the cause of the problem is actually the kind of language the parents use, or the kind of behavior that they met out to children? And if these kind of hard realities, this is what Shutapa is saying, if these kind of hard realities are there in a particular child's life from the beginning, how can a child be nurtured? Either by allowing her to roam in her fantasy world, or should they be made known of the hard realities of their life? And Dr. Rajendra says, how can trust and openness, which are some of the principal things you spoke about in the earlier part of your talk, how do you develop it in the context of adversity and poverty?
Mhm.
If you put these things together, Alexander, what would be the challenges to parenting, and how would parents negotiate these challenges?
Well, talking about the influence of the adults, Shekhar, do you mean in the COVID pandemic time?
Yes.
I can just share my experiences. Maybe it's different in India, but from the patients I've been seeing now, it's almost dichotomous. There are families and children who have told me, older children as well, um, this is, of course, awful, having the restrictions and the influence on their lives. But on the other hand, it has given them space and opportunity. So, talking to one child, an older child, she told me, do you know, in the pandemic at the moment, um, there's less traffic noise. I can hear the birds. I haven't been hearing them for a long time. Another child told me, the shops are dark in the evening, and I've been starting to see stars again in the city. I mean, these are positive aspects, and some have said, this is the best thing that could happen to me. School stress is gone. I can organize my day. Of course, there are online teachings and things to do for school, but I can just do my thing. I do not have to strive and struggle as I did every day beforehand. I'm really very thankful. And one girl actually told me, I mean, this is awful from objectively, but subjectively, this is what she felt. She says, I hope there's going to be another lockdown and then I'll have another time at home. And then there are the others who really suffer, who really see this is such a huge restriction. I cannot see my friends. I cannot go play football, or in India you would say cricket probably. I cannot go out and meet my friends. And of course, there are tensions and stresses in some families, not all, that have increased in this time. Studies have shown this. So I think this is a challenging time, this COVID pandemic. And if I look at the families that do manage quite well, I think what they do are exactly those things that we talked about. Provide a routine, have times when everyone gets up, takes care of the chores that have to be done, see that there are common meal times together, that there are enjoyable outings. In Germany, for example, you can almost it's almost impossible to buy a new bicycle nowadays, Shekhar, because all the bicycle shops are sold out.
Mm-hmm.
Everyone is going on the bicycle. So this is part of COVID pandemic, that families take time for outings, and then the children say it's so wonderful that we go on a bicycle ride. The other aspect you're talking about is, of course, a reality of all societies. There are families in which children are not taken care of
Yes.
adequately.
Yes.
And there are families in which children are at danger, not just they're hampered in their development, but they are really in danger. And what I find professionally very, very important, not to just take it at face value, but to look at the intention and the um, factors that might be behind it. So if a parent has their own emotional and psychological disorder, I think this is something different than from a parent who's callous and unempathetic and
Mm-hmm.
disrespectful of their children. So if a mother is depressed, has a severe depression, she, for example, will have great difficulty decoding the signals of their child
Right.
adequately, to respond adequately, to see what the needs of her child are. And this is something completely different. In this case, the priority should be to see that parents get help and provide support professionally and from family-wise and so on. If a child is really maltreated in families, this is the moment where the priority is really protection of the child. And I think in those cases, even as professionals, we come to our limits and we need the social services then to intervene. And sometimes children will then need special care by social services. I'm sure it's the same in your countries
Yeah.
as well.
Yeah.
Mhm.
As we come, Alexander, to the last segment of the session, and I'm going to relate some of the issues that have come up on chat from Dr. Shubhranshu and from Vanshika and from Rajendra. And I want to relate the questions and issues that they have raised uh, and invite you actually to take us through something that I know is very dear to your heart, which is sand play therapy. Now, the question is this, one relates to boredom, and the parents may be doing all their best to look at spaces and processes and fostering, but the child may complain of boredom. That and so, how do you maintain curiosity and wonder if what the parents are trying to do is kind of boring, or the child points out that the child's experience in fact uh, is what the parents are preaching, and no independent exploration is allowed. And Vanshika's question is, how do mental health professionals work with children who continue to go back to situations, as you'd mentioned, which are, let's say, traumatizing? Uh, if you could beat these thoughts together and really put it in the context of how sand play therapy actually works, and which perhaps even parents can engage in, it would address these issues that have come up. Some thoughts, Alexander, on sand play therapy? It's
Yes, thank you very much, Shekhar. Well, maybe the first point, which I think might be interesting, is the question of boredom. I think boredom is very important because in boredom, sometimes aspects that have been neglected come up, can sort of ferment and then continue on. And what some children nowadays have told me, children we've taken in as inpatients in my former hospital, um, they are all put on a digital diet. And the first days can be extremely boring to them because they are not able to use their gadgets anytime they wish. And many of them have said, you know, after these first days, suddenly I have experienced and have tried out new things that I don't think I would have done otherwise. So sports, arts, um, plays, creative activities, and so on. So I would encourage parents not to be put under pressure by their children complaining of boredom, but tolerating the boredom, going through it, and waiting until creativity comes up.
hmm,
And sand play therapy, it's I can put it into simple words, is a form of psychotherapy by which, as a medium, the child is given two sand trays on a table, small sand trays, so not the usual sand tray play sand trays they play on the playground, and then hundreds of different miniature figures. And the children are allowed to take any figure they like and then to build a picture or a world in the limited space of the sand tray. And in their creation, professionally, you can see aspects of their current conscious, but also their unconscious experiences. And relating to children through this media is quite magical because many issues come up that otherwise you would miss in verbal psychotherapy. So it is a wonderful adjunct. And by the way, I do sand play therapy even with adolescents, and they love it. So it's not just limited to the small children. Now, what can parents do? Basically, if the child is weaned off their digital excesses, sort of put on a digital diet, and given a space, then especially for young children, the medium of the sand is something so special because has such an earthly quality. It's sort of connecting with Mother Earth. And as soon as you add a bit of water to it, then you can build things. You can build buildings and roads and bridges and whatever you like. And adding a few toys like cars or trucks, a few figures, whatever. And within the shortest time, you will see children creating something in the sand. So giving space, just letting children be as they are, will lead them to experience play. And play itself, outside of the therapeutic context, is healing. So any play, any creative play per se, this is the child's medium of expression. And even if you do not have toys, I've seen children, take twigs and turn the twigs into little figures, or taking leaves, building huts out of leaves, or even taking discarded trash and building little buildings out of it. And within a short time, they're engaged in the play. So sand play therapy is a professional type of therapy. It's a form of psychotherapy. You need an indication. You should have some idea what you're doing. when you engage in this type of psychotherapy, because it's very powerful, but open play can be done anywhere. Does that answer your
Thank you.
question, Shekhar?
No, thank you very much, Alexander, for that. Vanshika, just one thing in response to the issue that you have raised, and Alexander also alluded to this, that if a child comes from really problematic family circumstances or even brutal family circumstances, uh, the issue of social systems and child protection systems actually coming in is one part of the intervention that is required, because it's a question of the child's safety, sometimes even the child's life. Um, so that's one part of it. The other part, of course, is to look at the trauma. And if we can work with the family, and corrective social interventions could be done in the family, but we work on the child's trauma through different methods, one of which is sand play therapy, which Alexander alluded to. The other is that psychotherapy often provides the context for the child's experiences to find an outlet, but it also provides the child an emotionally corrective relationship that you have not hitherto had. And if you look at what Alexander started with in terms of mindfulness, and and therapies that are mindfulness based, or for example therapies that are attachment based, this is the whole spectrum of stuff for children who have emotional and behavior problems, or children who do not, but have families that are compromised by their own struggles and their own issues, and parental issues or daily struggles, that how we still attempt to maintain the basic childhood. uh, this is in response to all the issues that have been raised. On behalf of the National Initiative and Integrated Resource for Child Protection, Mental Health, and Psychosocial Care, supported by the Ministry of Women and Child Development, Government of India, and located in NIMHANS, Bangalore, our deepest thanks to you, Dr. Alexander von Gontard, for sharing so much on the whole issue of preserving a sense of curiosity and wonder and nurturing young children. We come next on 28th of September, friends, with Dr. Jaswant Gazda, who's going to speak to us about raising children to think right and to do right, inculcating values and ethics in children. In the meantime, do subscribe to our YouTube channel and listen to some of the programs that have been shown earlier. There's a lot of stuff that you can gather on children's issues with particular reference to child protection and mental health, which is what we are trying to initiate and consolidate through this work that we are executing from NIMHANS. Be safe, be well, and be in good cheer. And we look forward to seeing as many of you as possible on 28th of September. We have 4 more sessions thereafter. We're going to be covering now is the time to study, not to fall in love, talking to adolescents about romantic and sexual relationships with Vinay Chandran on 30th September. Can I go to my friend's party? Addressing substance use issues in adolescence with Dr. Lekant Shukla and Dr. Jayant Mahadevan. Who is my real family? Parenting in the context of adoption and foster care with Dr. Aloma Lobo. And Parents Are Not God, balancing identity and selfhood issues with parenting roles with Dr. Prabha Chandra. As far as those who wish to get a copy of the book DC 0 to 5, we will let you know where this is available. I must tell you, it's quite expensive, uh, but some stuff is available on the net, not the entire book, but some aspects of it which you can really look into. Dr. Alexander, thank you once again. It was a pleasure, a privilege, and an honor to have you on Parenting Pathshala. Greetings, friends. Goodbye.